Hey, swear.
What's the weather like there down there? Where are you, Jem? Are you in London?
I'm in West London. Yeah, the weather's it's a bit humid today. It's not raining. It looks like it's about to, but it's hot still. Yeah. What about you?
Joy, look out the window. What's our weather like?
Dismal.
Oh, sounds like it's dismal everywhere then, because I'm near Stansted Airport and it's dismal here as well.
Oh, yeah.
Yeah.
That's Essex, isn't it?
Yeah, Essex? Stansted Airport's in Essex. I'm just in Hertfordshire. We're right on the border.
Ah, right. Yeah, I'm an Essex girl.
Oh, are you? You're an Essex girl?
Yeah.
I thought I recognised that accent. Doesn't sound Mancunian to me.
No, it certainly isn't.
Oh, Rachel said,
I don't sound like I'm from Essex. I've got my Yorkshire accent.
Yeah. Oh, yeah. Where's your Yorkshire accent? I can't hear it.
That's because you're in Manchester, but if you were down here living near Essex, you'd be able to tell that I'm not from these parts.
I want you to go broad Yorkshire for me, Georgina.
Well, you keep talking and I might join in as the time goes by. More of a northern twang.
Mine's a Lincolnshire accent, so yeah, not too far away. Okay, so I think we're going to give people maybe one more minute to join us. We've got 17 on, which is wonderful. We've had our first comment from Rachel. Thank you, Rachel. We're all looking great. Look at that. Thanks, Rachel. That was because last week I had to dig for a compliment for me because Izzy, who was on, was getting loads of compliments from our university, and I was like, nobody ever says anything about me. Oh. So you got in quick with that one. Okay, I think we'll probably make a start. So welcome everyone to our 10th A Conversation With, who would think it? My name's Emma Smith. I'm the project manager for Empowered Conversations, and I'm just going to hand over to Jem to introduce herself.
Hello, my name's Jem and I am a researcher at University College London. Thank you so much for having me. I'm really excited to share a piece of work that I've been doing for the last 3 years with Georgina.
Hello, I'm Georgina Charlesworth and I'm a psychologist at University College London, and also I work in North East London in the NHS.
Joy, okay?
Shall I hand over to Joy?
Yeah, I'm Joy Watson. I work with Alzheimer's Society and an ambassador for them, and I work alongside Emma with Empowered Conversations, as well as a few other things.
Thanks, Joy. Thanks so much. So I'm just going to run through a little plan for you today. If you haven't been to a seminar before, don't worry that you can't see yourself, because you should only see the panel. You won't see yourself, which is good for you and not so good for us. We've got a Q&A function at the bottom of your screen. So at any time, if you want to get a question in, pop it in there and we'll have plenty of time at the end for a Q&A. So we're going to do a little bit of background about Empowered, literally a minute about Empowered, and then we're going to hand over to Jem and Georgina, who are going to present their research findings. We'll come back and we'll have a little bit of a chat about that amongst ourselves, and then we will go straight into Q&A, and we'll have a massive 15-20 minute chunk of Q&A, so get some good questions coming our way, which is brilliant. So as I said, I work for Empowered Conversations. We deliver communication courses for family carers and also professionals in and around Greater Manchester. We also deliver something called Empowered Carers, which is a one-to-one support for family carers in Salford, and we deliver that through Zoom. Since COVID, like a lot of people, life has changed quite a bit for us, and our response for that has been to go online. So these seminars have been one of the weekly things that we've been offering as part of our response around that. We've also done a disco, drawing, a trip to the farm, group sessions, you name it, we've tried it and we're doing it. And it's just about, I suppose, creating escapes for people every day where they get an opportunity to meet others who are maybe facing some similar challenges and just have a bit of an escape from the day to day. So that's who we are. So I'm delighted to hand over to Jem and Georgina to start their presentation. I'm really looking forward to this.
Can everyone see it?
Yep.
Amazing. So today, Georgina and I are going to be talking about sharing a diagnosis of dementia. Now, when I say sharing a diagnosis of dementia, I don't mean when doctors or clinicians share a diagnosis of dementia with agencies. I'm talking about when people living with dementia or their carers share the diagnosis with. Oh. Okay. Sorry, having some technical difficulties. There we go. So why share a diagnosis of dementia? There are lots of different reasons, and this is very personal. I like to feel on this slide. So by sharing a diagnosis of dementia, you might get the right care. You might be able to obtain support from voluntary services, the Alzheimer's Society, or social services, for example. And sharing a diagnosis with others might help you plan. That could be planning for now or planning for the future. And also, and importantly, by sharing a diagnosis of dementia, you might get support from others in your life. Now, these can be friends or colleagues or neighbours or maybe your children. This is the reason why I share a diagnosis of dementia. But why might someone not share a diagnosis? Well, there are, again, lots of reasons, but the public attitude towards dementia might be one of them. Now, I don't know how many Daily Mail readers we've got here, but these are a couple of headlines. So, we fear dementia more than cancer, and the living death of Alzheimer's. Now, dementia has a lot of bad press, and the media have a reputation for not reporting information about dementia very responsibly. However, we are working to improve that, and Dementia Friends, for example, has been something that has tried to change that negative language around dementia. So we've got guidance now for the media and organisations on what language to use when referring to someone living with dementia. So we know now that using the term sufferer isn't appropriate. It's happening, which is amazing. I know we're joined with some right now, but people are still struggling to talk about a diagnosis of dementia, and there is still a negative attitude towards dementia out there. Now, what we wanted to do was help people to talk about their diagnosis and share that diagnosis in light of all of the negative attitudes around dementia. That help people wanted to do some learning from the mental health field. Now, in the United States, there's a program called Honest Over Cloud, and it's a program to help people who have mental health difficulties or diagnoses talk about them with others. And we found it and we thought, perfect, this sounds like exactly what we're trying to do for dementia, but the question is, would it be a benefit? Would people living with dementia want something like this? Would it fit in to our support system? So we asked people. Georgina, I'm going to hand over to you to talk about the development of the programme.
Yeah, just needed to get myself off mute there. So, so what Jem's drawn here for us is a little flow diagram of some of the things that we did when we were setting things up in the first place. Because this was a very new idea and we didn't know what people would even think of the idea to start with, we set up a consultation. It might even be that some of you sort of saw it. It was something that Jem put out on sort of Twitter and other social media sites, so that people could give us an idea about their views of the plans that we were forming. And then Jem worked on finding all of the literature that she could find about how we can best help people with dementia to be making decisions, especially sort of difficult decisions where you need to think about various pros and cons. And then we made sure that as we were doing the development, we stayed in good contact with people with dementia and family carers and others who might have an interest in this. So that's the overview of the development. And I'm waiting to see what the next slide is. Jem, who's got that? Is that you that's got that?
It is me.
Yes. Here we go. Is that the next one, or did you have something? Oh, right, okay. So in the one of the elements that we were looking for in the public consultation was to have an idea about whether people would have a preference for either face-to-face or online, whether people would like something to be happening with one-to-one with a facilitator and the person with dementia, or whether to have things in groups, whether to involve family or other supporters, or keep this just for people who have recently received diagnosis and are still in a position to be sort of talking about their dementia and their experience of receiving the diagnosis. So Jem gathered together people's sort of preferences, and the design was to create a workbook that had examples and information in it and exercises that could be used within the group meetings, to involve both people with dementia and their chosen supporter in those group meetings, to try to find settings that were away from standard sort of memory clinic or other health service settings, and to run the sessions for about 90 minutes each week for 3 weeks. And for those sessions to be led by people, for example, Admiral nurses or Alzheimer's Society support workers or age concern workers. So that was the plan. And then?
So,
are you going to talk through the 3 sessions, Jem?
I'll talk through the 3 sessions.
Lovely.
Thanks. So I'm now going to talk about the 3 sessions of the workbook. So in the first session, we start off by talking about little and the language. What does this mean to you, and what terms do they use to describe it? So do they prefer talking and using sort of medical terms like saying I have Alzheimer's disease, or do they prefer to say, well, I have some memory issues? What is the sort of language that people don't like? So coming back to some of the negative earlier that we see a lot in the media.
Jem, so I'm so sorry. The sound keeps going when you speak.
Oh,
it sort of goes up and down and up and down. I don't know why, but
okay.
Try for a little bit longer, and if it carries on, I've just asked Georgina if she wouldn't mind slotting in, because for some reason her sound's okay.
I see. Okay. Well, I don't want to get kicked off, but I'm going to have a go.
Jem, I think try sitting really still. I know it's tricky.
That's really tricky for me. Okay.
Still, it might be better.
I'll try to be still. And we finish off session 1 by talking about the advantages and disadvantages of sharing with someone that you have dementia. So we talked about reasons, I talked earlier about the reasons I was more share, and the reasons that people might, that may include worry that other people will see them differently, We know that some consultations, people have said that they don't want to burden other people. So all of those sort of experiences come out at the end of this session when we talk about the advantages and disadvantages of telling. And then in session 2, which is named Who to Tell, How and When, we are approaches to share. Now, in this day, you can stay connected almost everywhere with people anywhere. But that's not just it. It's not just about what modality you may use, but it's how much you want to share. And so we talk about there being a spectrum from sort of telling no one to telling everybody. And this is the opportunity that we have to remind people that it's their choice. And that in itself is really empowering. You know, no one should be taking these choices away from people. And those are the sorts of conversations that we have when we present this part of the session through these examples. I couldn't include them all on the slide, but here are just some of them. So we talk about Malika. So I haven't told anyone. I don't want anyone else to know right now. All the way through to Jeremy. So I wanted to show people that I can live with dementia and there's support out there. So I arranged to go on the local radio to talk about my dementia. Now that's two very different ends of the spectrum and there's plenty in between. And we ask people to think about where they might lie on this spectrum and that it's okay wherever they are and that might change. And then we talk about, well, you know, who's in your life and who do you want to tell and may not want to tell? And the way that we do this is through this exercise. Now we give people this on a piece of paper and we ask people to fill in names of those that they know that fall into each of these categories. So on the outside part, it's people who must not be told for whatever reason. And then in the next circle, you have all that quiet resistance yet. Then people you may want to tell, and then the second circle that we want to tell. Get people to see exercises out individually and then share them with the partner that they came with. And often I've found that people have, so there's a person with dementia who's come along with their spouse and got the same people there in different places. So it's very interesting to give people that opportunity to have that conversation and also learn about the preferences that each other have. Session 2 is heavy. I'm still talking about session 2. And then we move on to how to tell and when to tell. And so there's an example here from Tobias. So my neighbour is one of the first people I told. My wife passed a few years back and I've grown closer to him recently. We were talking about our health generally and I just said it. I just said that I'm having some memory problems. I didn't really think about it. And in Tobias's example, it was more a display of quite spontaneous disclosure. It wasn't really sort of planned out and meticulous. And we use this example to explain that sometimes you can't always plan things meticulously. Things will happen the way they happen, but engaging in the program and talking through planning things might help make things clearer. And then, how might others react? Everyone sort of comes to the group with their experiences. Unfortunately, some of them aren't very negative, aren't very positive. And so here we use an example, the current example, I'm going to call it. So I talked to Jeff and she said, Jeff, I don't know whether you've noticed anything different about me recently, but I went to the doctor and they said I have dementia. And then Jeff pauses and doesn't say anything. And we use this exercise trying to people to think about what's going on in Claire's mind and what's going on in Jeff's mind. And it may be that Jeff is pausing because he doesn't know what to say, or it might be that he's going to react negatively or positively. We don't know. And so we carry on trying to explore how people may react to the news. And then in session 3, the first thing we kick off with, well, is whose diagnosis is it? And that's because sometimes what happens is the person living with dementia may want to share the diagnosis and the carer may not, or vice versa. And there may be some conflict. And so that question, whose diagnosis is it, is important to talk about. Often carers feel that they'll get support if they share the fact that they're caring for someone living with dementia, but by not sharing, they don't have that support available. And so that's some of the things that were picked up by the carers who attended. And then we talk through what reasons might others have for sharing other than obtaining support. There are also situations where people share a diagnosis on someone's behalf without them saying it's okay. And this is Jacinda's example. So I had told a friend who attends the same church, I thought he'd keep the information to himself as I hadn't want anyone else to know yet. Anyway, when I was at church one day, another parishioner came up to me and said they were sorry to hear about my diagnosis. I felt really taken aback and I didn't know what to say. And this example is really about information control. So once you share something, you can't really take it back. So, well, no, not really, you can't take it back. And so that's really important to consider when you're planning. So, well, you know, it's not just about sharing the diagnosis, but maybe it's also about telling the person you're sharing what you want them to do with it. And the last part of session 3 is sources for support. So these are the national sources of support for people. What we also do is we're in London, we actually got areas and managed to make people more localised support, which is something I think we're trying to do when we tested that. So, last year now, we tested this programme in 2 groups, and I'm just going to talk about some of the themes that came out of the interviews that we did with people living with dementia and carers who attended. Everyone, the group setting was friendly, relaxed and welcoming, and information.
Jem, I'm so sorry. The quality of the sound is gone again.
Oh no! Okay.
Georgina, are you happy just to jump in and talk through these last few slides?
These last few slides, I'll see if I can do that. So yes, Jem was explaining to us that after the group sessions had taken place, and this was with 2 different groups, carried out some interviews to get some feedback about people's experience, and a number of themes then came out of the data. And the first theme is a theme that comes up often with groups for people with dementia and for family carers as well, is flagging up the importance of social support. So the first thing was that the group setting was experienced as friendly and welcoming. And here's some particular sort of quotes on the value of social support. Felt comforting to be part of a group where you could be open about many of the things that you don't discuss with anyone else. And I think perhaps there was a camaraderie in the fact that everyone was facing many of the same issues, albeit in different ways. And these quotes, I used to be involved in some work with something called Remembering Yesterday, Caring Today, which was a large group reminiscence activity for family carers and people with dementia in a large group sort of settings. And this was a similar sort of thing that came up there, just the value of feeling that others around understood without you necessarily even needing to say too much about things. And the next theme that came up wasn't simply about the value of social support, but things that were more particularly to do with talking about dementia. So just the chance to talk to others and to see what their experiences were. At the moment, we've got our experience, but nothing to relate it to. And then another quote from a person with dementia. I like the idea that these other people have the same problems, probably not exactly the same, but they know what it's like. So one of the concerns that people had often had before they even came along to the groups was what other people might be like who were there in the group. And there was a particular concern from some people about whether there might be things that made them more fearful about dementia or more worried about dementia. I'm sure that Jem will have mentioned it at the beginning, but it might have just got lost in some of the sound, that the groups that we held were particularly for people who were wary about talking about dementia or wary about saying that they had the diagnosis, and would rather withdraw from their usual activities or withdraw from family gatherings or clubs, not simply due to the fact that it was maybe too busy or too loud or too confusing, but because they were fearful of what others might say about them or think about them if they knew that they now had the dementia diagnosis. So here's a quote. I think it made it fairly clear at some of the meetings that one of my big concerns was meeting people who were further down the line to me. That was my anxiety of how I was going to deal with this, opening up and telling strangers. As it happened, you got to know the people in the group. The people in the group were lovely and it all went really well. So one of the other things that we wanted to know was whether people found the materials like the workbook helpful or not. And here was one quote, quite easy to go through it. If I'm watching the television sometimes and I had that booklet, I think it's upstairs, might go and have a look through it. So I think it's good. It's well put together. And this is a booklet that Jem now has and would be able to share with other groups. Although I think we are due to do a further iteration to it based on some of the most recent feedback, just to fine tune one or two parts of it. But as with all things, one of the troubles in this circumstance is trying to judge things in a way where the material is straightforward enough to make sense, even in circumstances where people's reading ability isn't perhaps as it once was, or the ability to remember lots of material sometimes causes some challenges. But on the other hand, don't want to make things so simple and straightforward that people feel as if they're being treated like a child or belittled in any way. So there were sometimes some sort of challenges with making sure that we'd pitched things right there. Now here's a comment from somebody: I'm not really a booklety type of person. I'd prefer to just do the talking. But I filled in bits, these circles. That was that diagram that Jem showed of the circles where people have a chance to think about whether people within their social circle are people they would like to share things with or not. They participated, it was clear and easy to understand, and the pros and cons were good. That pros and cons was the discussion about thinking of both the advantages and disadvantages of sharing the diagnosis. Now, one of the things that we hadn't included in the sessions, but that was brought up by really quite a number of the participants, was almost like a debrief of how people had experienced receiving the diagnosis themselves, and being told in the first place that the doctors considered that somebody's symptoms or presentation could be labelled as a dementia of some form. And so this person here had said, one thing I thought should also been discussed further was the question of how a doctor gives the wonderful news, and they're not really meaning the wonderful news, they'd said it in quotes, I suppose, the wonderful news that you've got dementia, because the word dementia, I suppose, in most people's minds carry images that are really frightening, and that fits in very much with what Jem was describing at the beginning about how often all of the information around us is about the fear that's attached to that label of dementia. So we had to consider whether we wanted in the future to include some time set aside so that people could share their story of how they received the diagnosis in the first place, and what implications that has for how they might then speak to others about it in the future. The next theme we're going to cover here is to do with what effect the group had on people, what its impact was, and how people found themselves sort of feeling or thinking after they'd attended the sessions. And one of the things that came up was that people did indeed find themselves reviewing or thinking either about how they reviewing the decisions that they'd already made when they'd already shared things, and thinking about how that might influence how they might share with other people in the future. And so this family carer was talking about thinking through the impact of sharing the diagnosis when they told somebody else. How might that other respond? How might other people feel as a consequence of feeling that news? And do they need to find a way to prepare people in some way? And one person with dementia decided that it was a good idea just at times to be perhaps a little more circumspect than they had been in the past about choosing quite how much to share and when. So the phrase there was, perhaps I was a little too cavalier. But one of the most important things I think we found was that for both people with dementia, and this was most of the people, not everybody that took part, were spouses, but particularly where there were a person with dementia and their husband or wife. We didn't have any, yes, we did have non-spouses, yeah. One of the things that seemed really important was the opportunity to start a conversation that could then be carried on at home. Another project that I was involved with was using an approach called cognitive behaviour therapy, and this was for people with dementia who were really very anxious, and we were looking at ways to support people to feel less anxious and worried. And I know that we had the same theme that came up there about the importance of people that live in the house together finding a way to have conversations that are really tricky conversations to start, really difficult communication to have. So we were pleased that for some of the people who had attended this group, they had found that the conversations in the group setting had been one that then they could sort of take home and carry on with. So somebody didn't used to talking about the diagnosis at home, but now they felt able to. So the Wendy that's referred to here was one of the other people in the group, to be a pseudonym for somebody else who was in the groups. It wasn't one of the group leaders, I don't think. Was it, Jem? No, yeah. So Wendy's very good at explaining. She's not the only person in the world that's got it. So it makes me feel good, because I don't like the word dementia. I just don't like it. Just makes me feel that I've got something wrong with me. So that for me, when Wendy was talking and explaining how she felt, I understood exactly that's how I felt. So one of the things about hearing other people talk about the diagnosis was that it helped to clarify for some people how they were actually feeling themselves. They might not previously have been able to put it into words, but hearing somebody else gave them some ideas for how to actually name or label some of their own sort of feelings and experiences. So there we go. That's all of the main themes from the study. This is something that Jem's written up in her PhD, and we'll be looking in the near future as to whether it might be something that's more accessible. And the description of the public consultation and the development of the group is also something that Jem has written up and has just recently been accepted in a journal called Clinical Interventions in Aging. So that'll be something that'll be available in the near future.
Brilliant, thank you. Jem, if you stop sharing that screen, I think your sound will be fine.
Is that any better?
It's better, it's better.
Oh.
I kept looking at your little sad face.
I'm so sorry. I don't know why.
I think it was just with you sharing your presentation, it just took a bit more data than everybody else, so it knocked your sound off. But that was brilliant, and I wondered, Jem, is there anything that you'd like to add now to what Georgina said? Because obviously Georgina just jumped in there. Thank you, Georgina.
Thank you so much. Thank you, Georgina. I put you on the spot there, well and truly. I don't think there's any. Georgina perfectly spoke to the findings, and for me, what really stood out, I facilitated one of the groups, and Georgina facilitated the others, and I think what really stood out for me was that this is such a gap in our post-diagnostic pathway, and it's just so important. How on earth can people just be given labels at a speed that we've never had diagnosed people before, and then not have any conversation about how they're going to share that? So the more I spoke to participants, and I don't know if you feel the same, Georgina, it certainly really spoke to the gap that we've currently got and we need to fill, I think, with this programme.
I noticed Joy like really nodding her head as you were saying that, so I wondered, Joy, if you wanted to come in and say something.
Yeah, just to back up what Jem has been saying, really. I wish something like this had been available when I was diagnosed some 6 years ago. Yeah, it would have been very valuable.
And because I'm nosy, so what I'd like to know, you talked about sort of spousal carers who were struggling to talk about the diagnosis. I wonder if there's a couple that just spring to mind who you could just share their sort of story with us, and how sort of coming on this had helped them to better talk about it at home.
So I've got one in mind, actually. There was a couple who came along, and the person living with dementia actually was very, very anxious about coming along and talking to others in the group. It was the first time that they'd actually ever met other people who were carers and people living with dementia. So yeah, there was a lot of anxiety there. And what we found is actually the carer wanted to be there more than the person living with dementia at the time, which is when we sort of started thinking about offering this program to carers, even if the person living with dementia doesn't come along or doesn't want to come along. And it also gave us an appreciation of the fact that this program can be delivered one-to-one. There's real importance in having it as a group a group discussion, because you get to hear people's experiences, and that's learning in itself. But for that particular person living with dementia, I think they'd have really benefited from one of the facilitators doing a one-to-one program with them. And in terms of the sort of after effects, when they attended and sort of went away, I think it was almost as simple as having that conversation that kept rolling. And that's the thing about sharing a diagnosis. It's not one-off. It doesn't happen once and it's done. You know, it carries on. You keep going. There's usually more than one person in your life, and you have different ways in which you want to talk to them about it. And these situations occur and occur and occur. And I think in the interviews that we did with that particular couple, they appreciated having the chance to have these conversations, because they specifically said they would not otherwise be having them. So, and that was kind of the point of the program. So I was very happy with that. I don't know if you've got anything to add, Georgina.
No, I don't think so. I think I was just going to say that clearly this wouldn't be in any way ever a compulsory group or something that anybody had to attend, because it's people's situations differ so widely. And one of the things that we know as we tried to do some recruitment through one of the NHS memory clinics is that for some people the diagnosis isn't even given until a point at which it's very tricky for people to be hiding or concealing the difficulties. So most of the people that took part in these groups were people who, for whom it was possible to cover up or to hide or conceal that there were times when they had lapses of memory. They'd often found challenges, they've often found strategies for having conversations without needing to remember somebody's name, or finding ways to keep a conversation going without needing to refer to any particular piece of information that they couldn't quite bring to mind at that moment. So there were people who either had developed those kinds of covering up sorts of skills or smoothing over skills, or there were people who had withdrawn completely. They'd stepped back from taking part in things. So this group wouldn't be for people who receive a diagnosis and who find a way relatively speedily to adjust to it and are quite happy to just say the diagnosis to anybody. You'll notice that the American version of things that this was based on, Jem said that for that version that was used for people with depression and severe things like psychosis, it's called Honest, Open, Proud. And some people are very out and proud with their dementia, but many people would think that that was even a strange idea, a strange concept. But so this group was for people who were wary about sharing. So not the people who felt confident that they could still be well regarded and well recognized even with the diagnosis. And also it wasn't for people where the difficulties that they were having would be so easily spotted by others that they wouldn't need to say or put into words what some of the difficulties were. So.
I really like what you do on session 2, where the circle of who you tell. And I just thought, because there are some people that you maybe wouldn't ever want to tell, and some people that you would absolutely want to tell. And Joyce, so it was the 4 circles. So in the middle, you absolutely tell, and then it sort of went to the edge of who you're never going to tell. And I just wondered if, Joy, you had any experiences around something similar, just from, you know, from your own life when you got a diagnosis?
Yeah, I think in the early days, because straight after my diagnosis, I did a nosedive into depression. And I myself didn't want to tell anyone at all, because I felt, well, they would possibly think, oh, well, if this is what dementia's like, you know, she's really depressed, that might influence their interaction with me. But 6 months down the road, after my diagnosis, I did decide to tell my family down south. And they were having a gathering, and individually I went round and told them. Now, for me, it would be different for everyone else, but for me, that was a big mistake, because I didn't have chance. I came away from the gathering and I didn't have chance to express anything else. And they just didn't know what to do with the information. So needless to say, I didn't have any contact with them for 6-7 months. So I've learned the hard way. Yeah, but everyone's different, aren't they? Everyone sort of takes on board the information that you give them. At my diagnosis, my consultant wished me happy birthday, and then within the same breath told me I had dementia. I mean, it didn't really go down too well, I tell you.
I know, Jem, you'd mentioned about how GPs give that news, and that was literally, it was Joy's birthday, and that was how the news was given to her, that she had dementia. So happy birthday, and by the way. So it was interesting that you'd mentioned that, because I thought, oh, Joy will pick up on that, because you know, if we think about how we would want to hear that news, that would be 1,000 miles away from how we would ever want to be told that piece of information. So.
Exactly, and as Georgina said, it really came through. People wanted to have those conversations, and it was, well, I mean, maybe it's not surprising, but we definitely had people that had positive experiences, some like Joy, but just had situations that shouldn't have happened in the first place, quite frankly, and that has impact, you know, that's going to stay with you, and it is going to affect the way that you continue to share or not share. But it's very rarely considered, and I definitely, as Georgina said, we'd really like to consider making sure that those discussions are weaved in future sessions.
Brilliant. Right, okay. Has anyone got anything else to say before we go into Q&A?
Joy.
Go on, Joy.
I'll quickly say, we have to focus on the positive. That was a bad experience, and as you say, it shouldn't have happened. But it empowered me to bring about change. You know, if someone had said, you know, come and have a cup of coffee and we'll chat about this, that would have been fantastic. But that didn't happen. It does now, because it empowers us to get change. Yeah.
Thank you, Joy. Right, so we've got our first question. So I'm gonna have to put my box over. Right, Georgina and Jem, if you want to say anything, make sure you give me a big wave with your left hand, because the box is over your face. I'm so sorry.
Okay.
Okay, so Sherilyn's asked, to what extent would you say BME were represented in the research, and have you noticed how cultural differences would affect a person's reasons to share or not to share their diagnosis? Thank you, Sherilyn.
Jem will want to answer that.
I want this one. Okay. So to be frank, there were almost all of the participants were identified as white, so it wasn't two diverse groups of people. And I think that's a really, really important question. It's something that I was constantly asking myself. When I was a support worker for the Alzheimer's Society, I worked in a borough with a predominantly South Asian population. And when I was supporting people living with dementia and care, it's different because the culture is different. And that's a very real problem when you're trying to, you know, make a program that sort of fits everybody. And so as researchers, what we have to admit is that that's probably not, one size fits all is probably not the best approach. And so Georgina and I have had conversations about sort of developing something a bit more specific. And that sort of starts with having conversations with people living with dementia from Black and Asian ethnic, what's the term? Black, Asian, minority ethnic groups.
But one of the discussions that we've already had around that, Jem, isn't it, that we wouldn't be wanting to cluster everybody together all under that same heading, because we're very aware that cultures are very different. And you were saying that both from your work experience, but also your own personal lived experience, that a lot of South Asian individuals find it very tricky talking about health and sharing health diagnoses anyway, not just to do with dementia, but for lots of other sort of diagnoses as well.
Absolutely.
And so I think we certainly wouldn't ever suggest that we were simply doing a version for white people and not white people. We'd be wanting to work with particular groups in particular localities to work out where the adaptations would need to be.
Yeah, and I think that really comes from an appreciation of the nuances between that sort of, within that BAME category. It's, my experience is going to, as an Indian female, my experience is going to be very different to sort of a Black female, same age as me, living in the same area as me. We're still going to have differences. And we know from the research that's already taken place, a lot of stuff that's come out of Brexit, that accessing healthcare and views towards our NHS and services and help-seeking behaviours are different within these sort of BAME categories. And so we really need to appreciate that although this programme covers lots of important ground, it's not going to fit everybody. And if we are going to try and help, specific groups within that sort of BAME category, we are going to go from that.
Thank you. Francesco's asked loads of brilliant questions. I'm just going to pick up one because that might sort of follow on nicely about how was co-production achieved, or was it more of a dialogue and consultation for your group work?
So what we did is we had Honest, Open, Proud, and what we wanted to do is turn it into Who to Tell, How and When. Or we didn't even have a title then, it was just a version for dementia. And so we tried to get a group together, sort of a research advisors group, and we advertised for it. And we got people who were interested responding. And so it was people living with dementia and carers. Specifically, the group was designed so that we could get feedback from people on the research process. So not just my project, but other projects at UCL as well. And from that group, we had a list. We had 5 people who were available for the full day meeting that we had to talk through every single session, every exercise, the language within it, what should stay, what should go. And what we were focusing on is what's relevant and what's suitable and acceptable for people living with dementia and carers. Because although you might find some similarities between mental health and dementia, there are differences. And so the co-production process was focusing on making sure that we as researchers were understanding those differences.
Brilliant.
But one of the problems with any of these more just discussions, it's all about how people imagine others are going to react. And so one of the reasons for also doing the interviews, where we were just talking about the themes that came out of the interviews, was that so that we actually had sort of detailed feedback from people who had actually taken part in the whole thing. And also for that, we had somebody who was observing the groups, and the facilitators also kept notes as well, so that we could try to make sure we'd captured views and opinions from all angles. So.
Brilliant. Sorry, I was just laughing because Joy's just lobbed a
Yeah.
Yeah.
She's like, it's a good way of dealing with it. Francesco's also made a comment here. So shared decision making from day one, no decision about us without us, introducing choice, describing options, helping patients to explore preferences and making decisions. Brilliant. Thank you for that, Francesca.
Can I just check? I don't know whether Francesca's still there and whether she can reply. Was Francesca thinking that they could be the session headings? Because I'd read those and I thought, well, those would be really nice session headings actually. But I don't know whether that's what those.
They've gone 1, 2, 3 with them. So yeah.
Yeah. We'll look out to see whether Francesca says anything else about that.
Fantastic. And then Masood has asked, how do you join the group?
Well, we don't have any running right at the moment because Jem's got to the end of her funding. So we need to work out what might happen next in terms of who might pick these up, whether it's within the voluntary sector or quite what. I think Joy had put a sign up.
Go on, Joy.
Yeah, I'm just wondering with the type of things that we're privileged to have within Power Conversations, whether that would slot into some of the things we do.
Could do, and I was also thinking there was some parallels there for Damien Murphy's work around the Getting Along programme. So sort of working with people once they've got a diagnosis, but as a couple or as a I think it's just around couples, around how they deal with that diagnosis. So I think there's loads and loads of link ups here. Yeah, nice one, Joy. But I think it would be really good because I think, like, you know, what you've identified and what Joy shared is that, you know, this diagnosis of dementia is not handled in the best way, and you know, we would all want that to be better, and how might that look, and the co-production work that you've done already is sort of, it's those foundations, isn't it? Like this is what it could look like. Damien's work as well, this is what it can look like, you know, once people have a diagnosis, and then maybe a bit about what we do, bring it all together. But yeah, absolutely.
I think that's a really good point, Joy and Emma. I think what I'd like to stress is that we're definitely not done developing this. We'd like to still carry on. It's not 100% there yet, and there's lots more. And there's many more avenues that we can explore and develop it further. So it really is exactly what people need.
And Amanda's backed you up, Joy. She said, "My thoughts exactly. Great thinking, Joy." Yeah. And that is why you're on here, Joy, to do this. Yeah. Right. So Emma said, "Thank you." Sorry, mate. I just put the Q&A box over your face. What were you saying?
I say I might have dementia, but I have a few good ideas.
Absolutely, a lot. Emma said, "Thank you. This is so interesting. How long was there between the 3 sessions, and was there a reason for this, please?"
So there was a session a week for a 3-week period. Okay, so the sessions were a week apart, and when we did the consultation about, you know, what do people want, one of the questions was how often does this, can you hear me, Joy?
Yeah, I can hear you, but I've done something with the screen, so don't worry.
I thought that was a reaction to me. Honest, Open, Proud is 1 session a week for a 3-week period, and so what we did in the consultation is ask people if that is what they wanted, and essentially yes, that they wanted a group-based and program happened once a week for a 3-week period, so we kept that design feature.
Brilliant. So it was another co-produced feature. That's what they'd asked for, and that's what you can. Wonderful. Brilliant. Well, we are 1 minute to 3 now, and I'd just like to say a huge thank you to everyone. Does anybody want to add anything that's not been covered or make any comments? We've had a few email sent to us, and we will contact people, and I'll share those out with Jem and Georgina as well, just to connect people up, because I think you've started a conversation today and people want to continue that, which is wonderful. So I just, oh, go on. Sorry, Jem.
Sorry, you know the Q&A box of things and the chat. Is there a way to save them somehow? And you're way ahead of me, aren't you? Nodding. Yeah, that's fine.
Yeah, I can set, so it all gets saved, and I can share that with you so that you can have all of those comments in the Q&A.
Amazing.
Brilliant. Oh, Sherilyn said, thank you. That was fantastic. I'm looking forward to more. So it's my job now to sort of bring us to a close and say thank you so much, Jem. Thank you, Georgina. Joy, thank you for sharing. It's been absolute brilliant as always. Thank you, our audience, for your contributions, for coming along and watching today, and for supporting these online seminars. We've got our last one of the summer, but we are planning to come back in September. So next week we are looking at so for our 11th one, it's shifting support from face-to-face to virtual. So it's sort of very, very, very much sort of in the present. This is what we've all been doing, and we've got the University of Worcester, we've got Age UK Salford, we've got Kiri Connections, and we've got Dementia Carers Count, who are going to be sharing their learning over the last few months around doing that. We're 1 minute over 3, so I'm going to say goodbye to everyone. I'm going to say thank you. We've had loads of thank yous and well dones from everyone as well, so that was brilliant. Thanks, everyone.
Thank you.
Bye.
Bye.